as part of the Sawa Project, which aims to address the widespread neglect of mental health needs in Eastern Africa, 29 young mental health professionals from Kenya, Somalia, Uganda, Rwanda, Tanzania, and Malawi got together for a 3-day conference in September 2025 in Nairobi. The conference was an opportunity for these young leaders to exchange ideas, explore innovative approaches to making mental health support more accessible and more acceptable, and build a network of mental health professionals in the region.
So the objective of the Sawa Project is to equip young leaders in terms of leadership skills, but also in terms of advocacy skills, and allow them to tackle mental health with more tools. It's also meant for them to build their own network of young practitioners, young professionals who are already experts and leaders in the field of mental health, but to nurture and create that network in Eastern Africa.
It's a significant pandemic, actually, that has not actually been recognized. It's a silent pandemic because we are not actually doing much about it on a public health scale. The way we ran around and did stuff for COVID-19, that is the extent to which we should be running around doing stuff for mental health and protecting the mental health of our children. There's a lot of taboos and myths around mental health, mental illness, and there's a lot of stigma. And because of this, there's very limited opportunities for people to actually seek services because of fear of stigma. And even families where they know someone has a problem, they tend to basically hide the problem.
The challenges are real. Mental health is a big issue not only for young people, but across the entire societies and communities. And that we need the young people to actually be present when policies are being made, when campaigns are being built. Young people need to be at the front of actually designing those campaigns, because they are the ones who are suffering the most the consequences of mental health. But when it comes to decision making or plans about the future of how we're investing on mental health or health in general, they're not really being asked.
There's a great need when it comes to issues to do with mental health in Eastern Africa, but also that there are lots of professionals and lots of strategies and methodologies and models that can be used. But also we have a lot of potential with the young people, young professionals, and there's great hope for Eastern Africa, but also great hope for Africa.
I'm doing healing services in the community. I do trauma-informed and healing-centered care advocacy trainings for teachers in schools, for leaders in the community, for the parents who are the caregivers of the children in the community. So that's how I'm doing it, giving them hands-on skills on how to manage their own traumas and how they are supposed to take care of the children or the youth in their care so that they do not get overwhelmed by the trauma.
Currently, I'm focusing on addressing the lack of awareness among Somali youth, because most of the youth in Somalia, they are silenced because of lack of knowledge of mental health, cultural boundaries and stuff like that. Currently, is lack of resources and lack of funding and lack of support, because in Somalia, we don't have a government that helps the youth, such as us, initiative that work specifically on mental health. So we struggle to reach more to the people, especially the people in the rural, where the mental health knowledge is very limited. We cannot reach to them.
Currently working on addressing the issue of single mothers' challenges that they face silently, basically the stigma and the isolation within their communities that often make them feel depressed and have a lot of anxiety because no one understands what exactly they go through. When you talk about young and single mothers, we're talking about women that have gone through a lot, what really contributes their different drives. Single mothers are made up of abandonment, sometimes the spouse dies, some are even rape victims. We even talk of irresponsible men as well. So there are so many challenges that are attached to single motherhood, only single mothers understand.
Following the conference, the young leaders will participate in a series of workshops to develop a solution and turn it into a concrete project plan. Mentorship and financial support will be provided to the 10 best projects. in partnership with the Kofi Annan Foundation, MCW Global, and the Africa Alliance of YMCS, the young leaders will also run an advocacy campaign to shift the narrative on mental health and ensure that it is recognized by communities and decision makers as equally important as physical health.
I must first say that the Sawa Project has been so much good for me. It's been exceptional of all the conferences like I've had to attend. Sometimes doing this work in our communities feels lonely, like you feel you're alone in the community and maybe nobody else is doing this work. But being in the space of this conference has opened up my mind and like, okay, I'm not alone. We are so many people, young people doing work around mental health, which has given me a new idea of, okay, like I'm refueled or re-energized to go back and do more work. It has opened my mind to go back and do the youth spaces, support the youth, to help them own their own healing and support in their community.